Bueno, bienvenidos a todos. Mi nombre es Mónica Caló. Yo soy gerente regional para América Latina en la International Osteoporosis Foundation y me es muy grato darles en esta mañana la bienvenida a nuestro la última sesión del ciclo 2021 de PPX Experts, donde vamos a hablar de un tema muy atrayente para quienes trabajamos día a día con los pacientes que ven afectada su calidad de vida por las fracturas por profundidad, como es el tema de la rehabilitación. Tenemos para eso un experto internacional que va a ser, es un honor que esté compartiendo con nosotros hoy esta mañana, que es el profesor Olivier. Muchas gracias por aceptar la invitación para compartir con nosotros su experiencia y su investigación en esta área. Y también nos acompaña la doctora Tania Senterman, que también es miembro de APU, también tiene expertise en el tema de la rehabilitación. Así que muchas gracias a ambos por participar en esta última sesión, que creemos que es un cierre de lujo para nuestro ciclo 2021. Los voy a dejar ahora con Victoria, que nos va a presentar a los participantes, pero antes les quería agradecer a todos los que nos acompañaron durante el año en las 4 sesiones. Espero que la hayan disfrutado tanto como nosotros. Y bueno, nos esperamos el próximo año, que seguramente vamos a, junto con su devolución del ciclo nuestro trabajo, vamos a pensar en nuevos temas para compartir con ustedes el próximo año. Muchas gracias. Adelante, Vicky.
Muchas gracias, Mónica. Bienvenidos todos los que van conectándose al webinar. Gracias, profesor Briel y doctora Seinfeld, por acompañarnos. En pantalla están viendo el título, el tema de la presentación de hoy: Rehabilitación en Osteoporosis, Calidad de Vida y Fracturas, y los objetivos que vamos a presentar a lo largo de esta hora de encuentro virtual que vamos a tener. Para presentarles un poquitito más en profundidad quiénes van a ser nuestros oradores hoy: el profesor Olivier Bruyère es profesor de Epidemiología Clínica en el Departamento de Ciencias de la Salud Pública y de Rehabilitación Geriátrica en el Departamento de Rehabilitación y Ciencias del Deporte de la Universidad de Lieja, Bélgica. También es jefe de la Unidad de Investigación de Salud Pública, Epidemiología y Economía en la Salud. Que fue muy exitosa, así que un placer volver a tener su presencia en la sesión de preguntas. Antes de dar la palabra al doctor Bruyère, les recuerdo que nuestra sesión cuenta con interpretación simultánea en español y portugués. En el final de su pantalla,
major health outcomes with a reduced health-related quality of life, with an increased risk of subsequent fractures. So that's a major public health burden. The good news is that we've got some effective treatment to manage a patient with a fracture. There are still some pain, there are still some limitation in physical function because of fracture. That's why we still need to manage patients with osteoporosis and with fracture with non-pharmacological therapies. Moreover, we also know that there are other risk factors for future fracture such as sarcopenia, frailty, poor diet, low muscle strength or power, poor body balance and so on. So we need to manage it once again with non-pharmacological agents. And it has been suggested by different international societies that the greatest outcomes after fragility fractures are obtained when we use a patient-centered multidisciplinary care. That's why I would like to discuss with you today some global rehabilitation, including of these exercises. We will also briefly discuss fall prevention programs, but also physiotherapy, nutritional care, patient education, and at last we will discuss the care pathways. So let's start with the exercise principle and the characteristics. As a matter of fact, many scientific societies, and it's, for example, the International Osteoporosis Foundation, describe exercises program for the treatment of the prevention of osteoporosis and its complications. And basically, if we look at all different scientific recommendations, they propose as exercises progressive resistance training, weight-bearing exercises, and also exercises with a focus on body balance. And if we look at what's generally recommended, it's progressive resistance training 2 times a week, weight-bearing impact training 4 to 7 times per week, and functional body balance, agility, coordination training 30 minutes 4 times a week. So, as you can see, I would say that all exercise therapy is quite effective, but must be performed on a very regular basis. And if you would like to have some idea to propose to your patient to perform some progressive resistance training, weight-bearing impact training, or exercises with a focus on body balance, there are some web tools such as the 2 Fit the Fracture recommendation with some exercises that you can share with your patient. Of course, in other websites such as the website of the International Osteoporosis Foundation or the website of Osteoporosis in Canada, there are many very useful exercises proposed by this society, once again, that you could share with your own patient. However, I think that it's fair for me to acknowledge that all this evidence supporting the recommendation of resistance training, body balance exercises has been developed in a pre-fragility fracture population. So it's clear that we've got some high level of evidence quality of life of the patient with a vertebral fracture. However, the findings are quite inconsistent and the quality of the evidence was very low. It means that we do not have a large, well-designed, randomized controlled trial confirming that exercise is really effective in patients with a vertebral fracture. However, once again, from what we know, in patients without vertebral fracture, and even with the low quality data that we have in patients with vertebral fracture, I think that it's fair, once again, from the scientific societies to propose exercises in the management of a patient with vertebral fracture. What's very interesting for our patient is that it's always better for sure to have exercise therapy performed in a hospital or performed in the unit of a physical therapist, in the setting of a physical therapist. However, it's very interesting to observe that even home exercises is very interesting for the patient, and that it's sufficient to have a physical therapist going to the home of the patient to propose a few exercises during the first few weeks after the vertebral fracture, and then if we look at the compliance to exercises, it's quite good for half a year. But then we need to have the physical therapist back to the home of the patient in order to motivate once again the patient into give different exercises, and we can see that we still have a good compliance to the patient at least for 8 months after the vertebral fracture. So it's important to have in mind that also exercises performed at home is effective to reduce the pain and improve the quality of life of our patient. Should pay attention with a patient with a vertebral fracture, because you are obviously aware that a new vertebral fracture is a major risk of the spine should be avoided. So once again, in patients with a very recent fracture, we need to pay attention in order for not to have a new fracture just because of the exercises. However, if we give the exercise, or if some highly specialized therapist, such as a physical therapist, a rehabilitation specialist, and an MD with some expertise in exercises, give some recommendation and give the exercise to the patient, then it is suggested that the impact of exercises outweighs the risk of further injuries. If we look now at hip fracture, and for example, got meta-analysis of randomized controlled studies suggesting that progressive resistant exercises could have a significant benefit on physical function after hip fracture surgery. So once again, progressive resistance training is effective. Interestingly, it has been also suggested, once again coming from a meta-analysis of randomized controlled trial, that body balance training could improve the of daily living after a hip fracture, suggesting that, once again, body balance should be part of the exercises recommended for your patient after a hip fracture. If we look also at another meta-analysis, it was suggested that structured exercise could produce an improvement on the overall mobility after that included progressive resistance training that we've got the more beneficial effect. It's quite interesting to have a look at the recent recommendation of the Cochrane collaboration. And the Cochrane collaboration suggests once again that exercise programs could reduce the rate of falls. However, we should acknowledge that we do not have many scientific evidence that exercise programs could also reduce other non-false outcomes. So it's not clear if we are able to reduce the fracture of the patient, if we are able to reduce the hospitalization of the patient, or if we are able to reduce the nursing home admission. So once again, if our objective is really to reduce the fall of the patient, interestingly, if we want to have a major effect, we need to have exercises that involve body balance and functional exercises. And it has been suggested that Tai Chi, because of the high impact on the body balance, could also effect on strength, on body balance, the effect of also on the nutrition and the poor nutrition of the patient. So let's be clear, here if we focus on different factors, we are also able to reduce the force of the patient. And once again, we need to include exercises. So it's good to have a focus on different factors of falls. However, we still need to have the exercises therapy. So whatever you propose to your patient, good nutrition, the pharmacological intervention, it's good. However, you also need to propose exercises to your patient. Let's move now to physiotherapy in patient with a fracture. And you know, physiotherapists, it's different strategies, including functional mobilization, transfer training, patient education, taping, manual therapy, and the use of assistive devices, with the addition, of course, so once again, a strong focus on exercises, but with the addition of different non-pharmacological modalities. It's very interesting to observe that, if we decide to have a high intensity physiotherapy compared to a control group, so high physiotherapy intervention and a control group with a moderate physiotherapy. So high physiotherapy compared to moderate physiotherapy, we can see that the probability of discharge in the high physiotherapy intervention is greater quickly, suggesting that high intensity physiotherapy is highly effective, probably to improve the mobility of the patient, to decrease the pain of the patient, to improve the mobility, to improve the physical function of the patient. It was also suggested that if we have just after the fracture, so once the patient comes in the hospital, immediately we've got a physiotherapy compared to a delayed physiotherapy intervention. So 2 days after being at the hospital, it was shown that the mortality was significantly higher in the delayed physiotherapy intervention compared to the immediate physiotherapy intervention, suggesting once again that it's very important to start the intervention home of the patient is better than no physiotherapist and is similar to an outpatient physiotherapy. So once again suggesting that if the patient is not able to go to the hospital, is not able to go to the office of the physiotherapist, it's still possible to have some whole physiotherapy and that's effective, we are able to improve the pain of the patient after a hip fracture. It's also quite interesting to note that it was suggested that motivational interviewing increases physical activity and self-efficacy in people living after a hip fracture. And it was a randomized controlled trial. And if I put here, I of course that I'm fully aware that motivational interviewing and at least in Belgium, where I come, during 30 minutes, probably 2 or 3 times a week. So they have the possibility to perform and to educate the patient. Very quickly, I just would like to highlight the importance of nutritional care. Why? It's because it was shown that in patients after a hip fracture, if we start to promote, if we try to assess the risk factor of the future mortality after a hip fracture, it's very interesting to observe that malnutrition is an important risk factor for mortality. Many randomized controlled trials confirm that nutritional care is able to really improve the outcome after a fracture. However, we have some data suggesting that if we give nutrition just after hip surgery, we are able to reduce some complications of the surgery. It was confirmed in another